Welcome to the NMSK podcast from the American Osteopathic College of Physical Medicine and Rehabilitation, the AOCPMR, the home of osteopathic physiatry since 1954.
Welcome to Grand Rounds Reimagined. We explore physical medicine and rehabilitation through an osteopathic lens, one conversation at a time. I'm your host, Dr. Haroon Andar. So grab a cup of coffee and let's get into it. Welcome to the episode of the Neuromusculoskeletal Grand Rounds podcast over at AOCPMR. I have a special, unique guest today, Dr. Yein Lee. You are an associate professor at Texas College of Osteopathic Medicine, and you have an extremely unique background that I did not know about until a few hours ago, actually. I'll be totally honest. You are the program director for the first ever Performing Arts Fellowship in Medicine, correct?
Yeah. So Performing Arts Medicine Fellowship, it wasn't created by me. It was created by Sag Survey, also AOC PM&R member. And then as he was moving up in the world, I kind of took over from him. And grew it and things like that.
Can you please tell me more about this fellowship, what exactly it is? Because a lot of doctors do side stuff and performing arts. Some are little artists, some are musicians. I know I play guitar myself, but I've never heard of it. So what does this fellowship entail exactly?
So the fellowship is basically, I like to tell everybody that it's a 1 year of immersive experience in the performing arts, honestly. And you could really change the fellowship the way you see fit because it's not ACGME approved. We try our best to try to do everything that is and follow the ACGME, guidelines and things like that. And I built the curriculum in a way that there are didactic portions, there's workout rules, and there are, curriculum. There are rotations that are built also that are educational for the fellow, but a lot of it is flexible for their interests. So like you could be a physician who's really interested in taking care of dancers. Our practice take care of Texas Ballet Theater dancers, and so they can spend a lot of time with them. Maybe they can spend time backstage. They can go to the classes and interact with the dancers. They can be at rehearsal and then sort of be a fly on a wall if they wanted to. They could do strengthening and toning coaching if they wanted to. So there's a lot of flexibility there. If you're a musician and if you wanted to take care of musicians, depending on what kind of genre you want, if you are very much of a classical musician, then you can spend time with our collegiate musicians at UNT College of Music is like the biggest music school in the country.
Really?
Yeah. And so they can go to all the studios and spend time with them and deliver, health and wellness talks, but also kind of, try to observe the studio classes. There's so many things that they can do. It's sort of very flexible. But they do traditional rotations, but it's more longitudinal. So they spend time with our orthopedic surgeon for our ballet company. They spend time with our ENT who has a voice clinic in Dallas. They spend time with the hand surgeon. They spend time with our PTs and OTs and SLPs. So they have flexibility, but also sort of the traditional structure of a fellowship.
Great. And I think that's incredible to hear. The first thing I thought of is, definitely rotation with a hand orthopedist, because if you're playing guitar, you're strumming your wrists all the time. If you're in the piano, you're using your hands. And if you're painting. So this is extremely interesting. I have never seen this before. But I think as someone who appreciates the fine arts and performing arts, I think this is incredible.
Oh, so cool. I'm so glad that you find it really neat. There's not many people who are into this kind of stuff.
So, I did learn a little bit about you. I thought this is a very interesting story. You were not born and raised in the United States. You moved here from Korea South, I imagine.
South Korea.
At the age of 16. And then that's not the traditional pathway we typically see. Can you tell us a little bit about you and what kind of got you here today and into medicine and PM&R?
Oh gosh, the story is I didn't do it. I don't think I'm really the reason why I got here. It's just series of, I mean, if you believe in higher beings and higher powers, then you can believe in sort of faith and how life you should be. Some people will say, okay, a series of coincidence. But I moved to United States really initially by myself, but there were relatives in New York. So I basically came over in Korea. There's 3 years in middle school, and so most of my primary education was in Korea, and I was done with my second year in middle school, I believe, or third year in middle school, or something like that. And then my parents set me down and they said, "You've been to the States before. You've even done maybe a month or two of school here and there.
Right.
Do you want to go over there or you want to stay here?" And I don't know what came over me, but I was like, I'm going to go to the States. I think
Okay.
that's what I said. So, I went and lived with my aunt and uncle and my cousin for a little bit. And then my sister said, okay, I want to go too. And so I think my sister came a couple months later, maybe six months even. I don't even know, actually. It's such a long time ago, right? I was young. It's definitely within a year, I think she came, and then maybe year or two into it, my parents were seriously considering completely immigrating to United States. And so eventually that happened. And then that's kind of how I ended up here. I don't think that was the original plan. I think the original plan was to study here for a little bit and return back. I think that was the original plan.
Was your plan
Yeah.
always to go into medicine and then PM&R?
You know, I think I would be lying if medicine wasn't in the back of my mind, because obviously I have a biology major.
Okay.
And so I don't
a
think,
natural extension,
firstborn daughter of a Korean family, medicine's very stable, right? Like it's sort of kind of a thing that a lot of people in my shoes consider. Not sure how serious I was, honestly.
Okay.
I came pretty close to minoring in music. I did a lot of music stuff in university. I majored in East Asian studies, but like art history. I even wrote a thesis in art history. So it was kind of like, I don't know. I don't think I was super serious about it.
What made you
Yeah.
decide now, let's say you're in medical school now, right?
Yeah.
You're a third year medical student, probably
Yeah.
going through rotations, internal
Yeah.
medicine. We all go through
Yeah.
that.
Yeah. Yeah.
What made you, because most medical students are not aware of physiatry, right? You don't have a guaranteed physiatry rotation. What made you stumble upon and say, this is it? This is the career I want. This is what I want to do.
Well, I think actually now most osteopathic medical students know PM&R.
Yeah.
I
So that's
know.
good.
I don't know if it's a good or a bad
Yeah.
thing for our profession, but at least from an undergraduate medical educator perspective, I kind of love the fact that so many medical students really love PM&R. What made me think of it? Well, I wanted to be a physiatrist really from the beginning.
Okay.
And so, well, I don't think my science was very strong, so I had to go back and do my, what is it called, pre-bachelor or whatever program.
Yeah.
And so I was doing that, and then long story short, I met along that journey, I met a physiatrist, and I said, "Oh, I want to do what you do. That's what you're doing is pretty cool." And then he said, "Oh, you should go to a DO school." And I said, "What's a DO school?" And he said, "Oh, your personality is so perfect for an osteopathic school." And so, and then that's just kind of a long story short. And by the time I came to, now it's Rowan, so back then it was UMD&J, my medical school, there were a few people who were already sort of very much involved in sort of that medical school PM&R track.
Right.
And I just got connected with them really fast. And, the field where you take care of people who are disabled or down and out, I don't know. There's like, what is there to say? It's amazing. The people who are, you take care of people's function, you focus on function, you focus on quality of life. Like, there's really like nothing bad about that.
Yeah.
And so, yeah, I think
Well, you're the first person I've talked to who is an associate professor.
Uh-huh.
So take me down your day to day. You're a professor. Do you do inpatient, outpatient? How do you mix the two?
Oh, so I have a really strange practice.
Okay.
So I would divide my job into two different things. So I work for an osteopathic medical school, right? So that's a little bit different even for like people in medical education because a lot of us are in GME, but I'm in UME. And so I usually divide my job as, okay, this is my performing arts medicine / GME role. And then this other job is my UME medical education role. And there's like a big job in between where I cross both. So I'm going to talk about that first.
Okay.
My current job, which this is kind of weird because I'm actually leaving my job in a little bit. So I'm in a, yeah, but right now what I do is I am the director of osteopathic medical education. What that means is I support a lot of the GME programs where TCOM is a sponsored institution for their osteopathic education. So that could be OMT or any kind of faculty training, student or resident training. We provide that. And from there, on the GME side and my clinical practice side is that I run the Performing Arts Medicine Fellowship. I also run the Performing Arts Medicine program. And so we have many coverage of collegiate universities, right? Like dance teams and music schools and things like that. But also we cover Texas Ballet Theater, some of the performance institutions around DFW area, but also our fellowship is supported by a philanthropic support. So I sort of try to make sure that, you know, every year I kind of get that funding because, you know, arts, you don't make money by supporting arts.
Yes,
and so there's some of that work, that philanthropic work. And then also coordinating fellowship schedules and relationships so that we can provide the fellowship education, but also like the arts experience for the fellow. I also cover our ONMM, so our osteopathic neuromusculoskeletal medicine residents on that side.
You wear a lot of hats.
I do. I do. On the other side, I do teach in OMM lab and TCOM. So not much as I used to, but I still do that. And then I advise our students at school. And so, you know, some of our students, TCOM is a big medical school. So we divide them into these houses. And then, you know, there's a lot of mentorship and support and do those things. So there's some classroom, there's some sort of that osteopathic medical education portion coming from a sponsoring institution in the osteopathic world. And then there's that GME. And then my clinical practice is like, I didn't even mention that.
Yeah, I was going to say.
I have my own private. Yeah.
So you have your own private practice?
Oh, you know, it's like a half day to a full day a week where, you know, mostly now it's just word of mouth of musicians and dancers. They
come to you for NMSK.
Call me up and say, I heard that you take care of this musician. Can I come and see you? And so, yeah, that's kind of how my private practice runs. Not private practice, but like my practice is sort of run that way. I usually try to find the time in my schedule to where can I fit you in?
Yeah. So you talked about, I just want to backtrack. You talked about leaving a job.
Yeah.
Does your current job know that? Is it breaking information in the podcast?
No, I'm in it for weeks.
Okay. I just didn't want it to be the, news
it's not a surprise.
You know? Okay.
It's kind of a weird thing. I didn't know, what we were going to talk about, honestly. Yeah. So it's a weird thing to say what I do when I'm kind of thinking about, I'm kind of wrapping all of these things up in many ways. And so.
Great.
Yeah.
And, I do agree with you.
Yeah.
About lack of money in performance because it reminds me when I was younger, I was a musician. I played saxophone, guitar, and I told my dad I wanted to be a musician. And he said, "That's great, son. You know who else is a musician?" I said, "Who?" And he goes, "The homeless guy down the street." I said, "Oh," and he goes, "So go to medical school, become your doctor, and then on the side you can practice your music." So that's ended up kind of what happening with me. Yeah, I know. That
sounds like what happened to my husband.
Yeah.
My husband is a very gifted singer, and he was he said that he wanted to be an opera singer.
Right.
And then his father told him that, when was the last time you saw an Asian Don Giovanni? And And then Clark said, fair enough.
Yeah. I know. It's sometimes you just need a thing to tell you and the light goes off and you're like, okay, fine, it is, you know. But yeah, so that's do you now when you teach students or residents, do you offer them what are some advice that you offer them about pursuing their passion and especially I'm sure you've gotten it, you've probably had someone come and say, I'm a little confused about whether I should go into PM&R versus orthopedic surgery or sports medicine through an FM pathway, family medicine pathway for those who aren't aware. What advice do you offer them in choosing PM&R? And we obviously respect all the fields, but
Yeah, I talk a lot about. First, I think good advice comes from getting to know the person in front of you. And so I think I spend a lot of time just getting to know them first. So understanding their personality. Would you agree that we're a field where we kind of have to be likable in some ways, right?
Have to be very personal,
Yeah. I think we have to be team player. I mean, I'm not the only one who says that, right? Many physiatrists say that. All we do is talk to people. Other specialties, PTs, OTs, SLPs, families, patients, we're often the ones who are breaking the bad news along with the prognosis, even though we feel like we shouldn't be, but we are, right?
Absolutely.
And so I think understanding that personality is inside of them, I think it's important if they want to pursue PM&R. I think also, practically speaking, you probably do need to really love neuro, MSK, like you do have to kind of like this type of subject. If you want to be a physiatrist and you really don't like,
I agree.
I think that's, I just kind of ask, hey, we just went through a musculoskeletal system. Did you like it? Do you love it? Do you like neuro? I ask these things and they're sort of, if they're saying like, yes, doctor, I loved it, then I think, okay. And then those are some of the things that I first ask, and the personality types, do you need the acuity? Not that we don't have acuity in PM&R, we have plenty of acuity, I think, from my perspective, but maybe not from a trauma surgeon's perspective.
Right.
Yeah. And so I think some people just don't know that because they're still quite young, right? Like they need to kind of know that. But also just kind of understanding that, maybe they have had exposure to just one aspect of PM&R. Maybe they just saw brain injury, or maybe just they saw sports and spine, and so do they understand how big our field is also? Just kind of asking all these questions. I think that's like the first step. And then I try to figure out where do you fit?
Yes.
I try to see, okay, who are you? Do you lean more this way or do you lean that way? And I think it's never of me figuring out who they are. It's always a conversation. And I think when we have these conversations together, I think we both together end up in the right place.
Yes.
Do you know what I mean?
Yes.
I don't have like a good answer for it because individual mentorship is like that. I think you just talk and communicate and get to know each other.
Absolutely.
And then they ask me questions and I ask them questions and then we just kind of get to the right place at some point.
I think it's very powerful what you said, that in being in PM&R, you have to be very personable.
Yeah.
One, and you do have to be a team player because I remember, unlike some of the other fields of medicine, which are very great, but they'll come, they see the patient, sign off on the orders, leave. With PM&R, it's one of the only specialties I know, unless I'm mistaken, but I remember in our residency, we were doing inpatient, right? And it'd be that twice a week meeting. I would sit in that table. It'd be me, it'd be the attending, and then you would have essentially PT, OT, you would have neuropsych sometimes sitting there, you have speech therapist, and then the patient would come and sometimes their family member essentially would come too. So you would all be at the table together and the nurse that took care of the patient. And we would all talk about, okay, this is this patient. This is her diagnosis. Let's run it down, speech therapy, how's language going? Oh, comprehension is getting better. And then you would talk to OT. Are they having any issues? Okay, well, they would have this. Then PT would go by with ability to ambulate. And then finally it would come down to us as the final decision, whether to keep him or discharge. And you really have to work with everyone because, and you know, half the time in rehab, when it's time to round, you go in that room and you're like, where's the patient? Oh, he's in therapy now, you know? It's like you have to run, you know, to the gym and then
You know, I really do used to love rounding in the gym because you like,
yeah, you would get
this
like
is so much faster.
there, we're done.
Yeah, we're done.
And it was always a very interesting experience. But and you know, the therapist would come and they would tap you and say, "Hey, are you working with this patient?" You're like, "I'm going to this one, but what do you need with this one?" Well, this patient, I'm noticing they're having this trouble, you know, using fine motor skills with their hands, you know, their upper extremity usage. And then you then have to stop and talk to them. So if you are not able to work in a team, it's going to be a very difficult specialty, in my opinion.
I think so. It's definitely not one person run everything
Absolutely.
kind of a field. You know, I had a co-resident. She's like such a perfect PM&R personality. You know, as soon as we got there, I remember she, you know, when she was like first call she was on,
Right.
she would already be like best friends with the nurses.
Right.
And then they order Chinese overnight and they're like chatting. And I love people, and I think, you know,
Right.
I think I get along with people fine, but I was like, whoa, you're like a whole nother level. It's just like, as a PGY too, first call, she was already like best friends ordering Chinese and like already knew all of their boyfriends, girlfriends, you know, like they knew, it's like she knew all the tea. And I was just like, this is great. It's awesome. And that's, you know, that's what I really love about our profession, you know.
So what instruments do you play?
I play the violin. I used to be decent. I don't know if I'm very good anymore, but
Okay.
I still tinker around once in a while.
Who's your
Yeah.
favorite musical artist?
Oh gosh, that's a really hard question.
It could be anything. Doesn't have to be violin either.
You know, my favorite musical artist, alive or dead?
Either one.
Oh my gosh.
Someone that influenced you the most, the musician.
Someone who influenced me the
Yes.
most? Oh, that is I have to think about that, my friend. I think someone who influenced no one, so musically, someone who influenced me the most is no one famous. He was my first violin teacher.
Wow, that's powerful. That's
Yeah.
really,
So I was I started, I think I was 6 probably. My mother's a pianist, and she had a piano studio and then like a kindergarten in Korea, and so I don't even know when I started playing the piano. I sucked at it then. I still suck at it now, and but she, you know, she was like, "You need a second instrument," and I said, "Okay," and she said, "What do you want to play?" And I said, "Okay, you're giving me a choice." I said, "I want to play the cello." And she said, "No, it's too big for you. Pick violin." I said, "Okay." So that's how I got the violin. And I had this wonderful, wonderful teacher who I would walk to his home. He gave private lessons to children. And this is 1980s, early 1980s in Korea.
Right.
You know, you can walk anywhere. You're a child. It was fine, you know. And I would, you know, bring my violin, sometimes slide my violin on the ground. You know, just really got there. It was we played and we sang. He every time we have a music that we needed to learn, he would like taught me how to tap beats. He taught me how to be a really good. He was such a gentle teacher. He, looking back, I didn't know that obviously then, but he definitely changed his teaching style depending on the child. Understood how to teach children appreciate music. Like there are lessons where I didn't play at all. We just sang the whole time. Okay. I still remember that. And I think that's, yes, like that affected my music too, obviously. I don't think you know, by the time I was in university and adult and, you know, I knew that I was going to make professional money out of music. No way, right? Like that. I already knew that when I was in 4th grade. And, but all of that lesson, I think he taught me a lot about life, even though I was very young.
That's yeah, that's a very powerful statement.
Yeah.
And I agree. It's so like if someone asked me, right, it'd be
Yeah.
so hard for me to say who is the musician that influenced me the
Yeah.
most, who is my favorite, because
Yeah.
someone who plays music, there's so much you can get from different musicians, you know.
Yes. Yes.
So it's
Yeah. Yeah, I think so. I think influence is a different thing from who do I love the most. That's also really challenging. I don't think I can give you an answer for that.
I'm trying to think.
Do you have one?
Oh,
No.
the musician that
Yeah.
influenced me the most. There's a lot. So,
Oh, really?
I mean, in terms of
Yeah.
off the top of my head, I'm trying to think of one, I guess, that had the most influence.
Yeah.
When I was a kid growing up, I was very much into punk rock music. It was
Oh,
I
yeah.
was in second grade or third grade, very young. I always had an
Yeah.
inclination toward music at a young age, you know,
Yeah.
most people. My brother gave me, it was like 1995. He gave me a CD by a band called Green Day at that time.
Oh,
So
yes.
I was instantly hooked with this album.
Yeah.
Billy Joe Armstrong, the
Yeah.
guitarist, played
Yeah.
a tremendous influence in
Yeah.
my liking of playing the guitar and music.
Yeah.
And then my dream guitar was the guitarist for Blink-182, Tom DeLonge.
Oh.
I was in high school and I said I really wanted this guitar, and it does tie into medicine, but you know, you grow up. We weren't very financially well off growing up, and I remember my dad and my brother said, "Well, if you go to become a doctor one day, you can get that custom-made Tom DeLonge guitar."
Right.
So I was, you know, fine, you know, I'm gonna do it. You know, you're young, you're like, I'm gonna. So I go to medical school,
Yeah.
and I still remember that. I never got over that, even though I had a small Epiphone, which is a very simple low-tier guitar.
Yeah.
It was my dream. When I got out, I mean, this is like 10 years later. This guitar is no longer in print anymore. It's gone. Like they don't make it. 3 years ago, they reissued it.
Did you get it?
Yes, I did. Actually, I did. I went straight after I was seeing
That's
patients.
awesome.
I did procedures. I went to
Yeah.
Guitar Center. I said, Tom DeLonge guitar, I will take it. And the guy laughed and he said, do you know, go on social media, look at all the stories you hear. And everyone had the same story as me. They said that, you know, I was young, I was in high school, we didn't have any money, and then we got this guitar. So apparently there were so many out there. So when
love
they
that for
reissued that, yeah.
I love that for you.
Yeah.
That's so
I
great.
know, I go full circle, yeah. So
Yeah, my mother and I were talking about that the other day too, like going full circle. Because when I decided to go to medical school, I really didn't think that I didn't even think that I could take care of musicians and dancers.
right.
Right? And my mother, when she said that she was trying to like introduce us to music and all of that, and she said that there was like a sliver of something in their head, maybe like they would become a performer.
Right.
But she didn't think that. And she spent a lot of money,
Yeah.
you know? There was a lot of money
There
in the
is.
arts, you know? There were times when I was very serious about music. I had like 2 different teachers. I was
Right.
auditioning all the time. That's when I realized that I wasn't going to be a concert violinist. And, you know, and I was talking about that the other day, and my mother was like, yeah, who would have thought that you would do this? And then even though I will never fully understand like the plight of the very high level performers that I see every day now, like they're just artists, right? And they just suffer in so many different ways. But I kind of know a little bit, just a little bit.
Just a little bit.
Yeah, just a little bit. I think that helps.
Yeah.
And it's all of that. It's kind of, you never know all these things, how it's going to come back to you. But then somehow it became a piece of puzzle of who you are not right now. And I know that my picture is not complete yet, but it's filling in, you know, as you grow up, I guess. Oh, that's my phone. Sorry about that.
Oh.
Apologize.
No, you're totally fine. Let's kind of talk back about the osteopathic manipulation you do.
Oh, yeah.
I think this is such an integral part. Actually, it is the number one thing that separates the allopathic field of medicine versus the osteopathic field.
Yes.
Just take us through like how you leverage osteopathic manipulation in your day-to-day clinic, or in the clinic you use, especially with musicians.
Yeah.
Anything you do in terms of whether it's myofascial release, high velocity, low amplitude. muscle energy. I know these are the different ones I remember. You know,
Like different
yeah.
techniques. Do you do OMT?
So actually, I don't do much OMT anymore. Yeah, so I know I'm coming off as a bad DO. I don't do a whole lot. Yeah.
I really
Um,
don't want people to think that just because you don't do OMT.
in residency, I used to do a lot of it.
Yeah.
And you know, it was great. But after kind of leaving, I was so focused on interventional pain that I don't do it as much. But I do believe that I do it on myself, ironically. I do like, I do like my own
Like
HVLA, right?
OMT.
Yeah, and I crack my spine sometimes. But
Little manipulation.
yeah, absolutely. So it's very important. But I wanted to know how you kind of leverage
How
it.
do I do that? Well, one thing that I'll say is never too late to do. I know it's hard to do OMT when you have an interventional, like a very busy interventional practice. Honestly, that's just like the life problems. I don't think I was like the best OMM person in my class. Honest, there were so many. I mean, still so many people. There are so many people who are just really good at OMT.
Right.
I saw a value in it when I was a third-year medical student, and I thought, immigrant mentality.
Yes.
Yeah. I thought, you know what? Like, everything fails. I can still make money and make a living out of this.
That is true.
Yeah, and I thought, okay, I should probably get good at this. So I took a lot of extra courses as a third and fourth year because I knew I was behind. I was not good at it compared to other people.
Right.
And I'm a shy person in general. I'm introverted, so even during like residency or things like that, it took a lot of courage for me to ask my attendings and say, I think this patient needs OMT. Can I do it?
Right.
But every time I did it, everybody felt better.
Right.
You know?
Yes.
And I would always think, how could that be? You know? I would always be like very surprised. I'd be like, I just did 2 things. Like, why do you feel better? It's so weird. And then more of that kind of came together. I realized, oh, this is really something. And you know what it is? When I found out about performing arts medicine, I was at PGY3. Lauren Nelson did a talk at AAPM&R. And I went up to her. I said, how do you do this for a living? That's a whole different story. But only maybe like within a couple of weeks, I found out Saj Survey was leaving from his New Jersey position, going down to Texas to start a performing arts medicine program there. And that led to me thinking like, oh, I want to do more of that over there with him. Right. And that was pretty much that his program was very much heavily based on OMT. And so that kind of made me start picking up my skills a little bit more and all of that. So that's kind of the background story. There's a lot more story behind that, as you can tell. But to answer your question, everyday OMT for artists, I honestly don't even know how I would take care of artists without OMT. There's a huge demand in the public, not just artists. Patients want integrative osteopathic type of care. They don't want straightforward pharmacological. They don't always want interventional right away. They may need it at some point. Right. But OMT really provides that sort of in-between. It could be a treatment that solves a problem, or it could be a treatment that helps them participate in rehab better. It could be a treatment that gives them that temporary pain relief, even if it's not sustainable. It's so versatile. And then ultimately, it just gives you more opportunity to put your hands on the patient. I think that's helpful too. I know that's not scientific and medical, but I think it provides that therapeutic bonding more effectively. So that's really helpful, you know? That's just like a small part of it. But I don't know if you know this, but musicians have a lot of functional problems.
Yes, that I do know. Yeah.
And they're not always pathologic, you know? Yes, they have plenty of pathologies, musculoskeletal pathologies, obviously, or neurologic, you know, compression neuropathies, tendinopathies, right? Like, you know this. But sometimes they have these weird things, like a zinger
Yeah.
You know,
Yeah.
what is that?
Yeah.
You
When I hear
Yeah.
zinger, I'm thinking of like an athlete, but yeah, a musician.
like
Yeah.
fingertip zinger. What is that? I can't, is that a small, tiny digital nerve that we can't scan? It's compressed? Maybe. But do you know what makes it better? Little bit of balancing technique on their fingers. And then they're sort of like, oh, wow, that's gone. And I said, okay, I think maybe there's an instability here. Isolated hypermobility. Let's tape that. And then that's it. The solutions, that's it. Functional problems, no disease, right? I scan it, there's nothing there. No, like not even degenerative joint disease in the IPs. Like, they're 23, And so that's just like a small example of it. But there's so many of these strange complaints that could be explained by maybe somatic dysfunction.
Yeah.
And it plays a very big value, and they start to trust you because you're that doc who didn't tell them, oh, it hurts when you do this. Stop doing that.
That
right?
must be so
Yeah,
frustrating
it's
for a
really
patient to
frustrating
hear.
for them. So I said, oh, it hurts when you do that. Tell me more.
Right.
What if I do this? Does it feel better? What if I do this? Does it feel better?
Yeah.
What if I change your equipment? Or it's PM&R 101, right?
Yeah.
Like, how do I change your equipment so that you don't play weirdly? Piano.
I
What
100% agree.
kind of environment that you're in that you feel like this? Biopsychosocial. PM&R 101.
So this
Yeah.
is a very
Mhm.
comprehensive,
Mhm.
holistic, osteopathic
Yeah.
way of treating a
Yeah.
patient, which I think is absolutely,
Yeah.
it's an art.
Yeah,
It
yeah.
really is.
And it's so fun.
Yeah.
And you feel like you get a window of opportunity to go into this person's life. And especially for me, like go into their art.
Right.
And so I get this like satisfaction secretly by myself.
Yes.
No one knows. If I go to their concert, I'm like, oh yeah, we did that together. This is great. I just sit there, and then sometimes my husband comes on and be like, look.
Yeah.
It's really great.
So I think the last question I will ask you
Yeah.
is, you are the founder of the first Performing Arts Medical Fellowship,
Oh, now
co-founder.
yeah, and also founder is Dr.
Yes.
Survey.
Sorry.
Yeah, I built it with him, but yeah.
What is the
Yeah.
legacy you want to leave behind with this? Because this is so unique, which you've been
Yeah.
able to contribute to.
Yeah.
What is the legacy you want to leave behind as a doctor with that?
I would love other areas of the country to do what we do.
Right.
That would be so great. There's not enough physicians who do this work because it's just really hard. It's hard to treat artists. It is really, really hard. And if you are one type of an artist, it's very hard for you to understand other type of artists. For me, it took me a lot of studying to be able to take care of ballet dancers.
Right.
I took ballet, but not very well. I never went on point. So I didn't have that high level professional understanding of what they do. And so spending a whole year with a survey before joining the practice, just taking care of the dancers really, really helped me.
Right.
And so those kind of experience became pieces of the fellowship, right?
Gotcha.
I did this, so how can I make this better? I wish that I had this. So I went out there and talked to the community and see if I can add those pieces to the fellowship. And so we were able to build that in our community. It would be so great if we can build that around the country. Hopefully more, and then eventually lead into sort of, I'm a physiatrist, I'm biased, but I think PM&R docs should lead this. We are uniquely positioned to understand this population, just like how we're great at treating athletes because we just understand function and high performance, right? Like the what's at stake, right? And so I would love for us to lead this and maybe even create I don't know, maybe this is a stretch, maybe create a board certification or something that helps us distinguish ourselves, not because to be distinguished, so that the artist can come and find us easily instead of going to like 15 doctors and then until they come and find us, right? Like just so that we have a community of doctors that is large enough so that artists around the country can come and get care faster than how like that's really kind of what I want. I would love for that to happen. I don't know how that would happen. I would love for that to. All I can do is every day do my best with my patients and do my best with the organizations that I belong to and the friendships that I built around this field. Everybody is so fabulous, and the people that I've worked with so far, especially in the PM&R world, amongst the physiatrists, not just the DOs but MDs too. Right. We have a pretty tight-knit group of performing arts medicine docs, and so we email each other often, text each other often, because really, like, there are a lot of strange cases that happen in the arts world, and chances are we're the first one who saw it, and so we would email each other and text each other like, how would you do this? And they'll tell me like, okay, I think I could do that. Or no, I already did this. What do I do then?
No, I think that's great. And obviously, I wish you the best of luck with this. And hopefully this is very interesting that we see further expansion into this unique niche sort of field. And I think you said it beautifully when you said that we work with a lot of athletes, right? But we kind of forget about the performing artists.
Yeah.
So I think that's great.
Small muscle artists. Well, I mean, not our dancers, but musicians, small muscle athletes. That's what I call them.
Well, Dati, thank you so much for coming. This was a great conversation.
Nice to meet you. Thank you very much.
The views, opinions, and factual statements presented in this video are those of the presenter alone and do not reflect the views, beliefs, and/or policy statements of the American Osteopathic College of Physical Medicine and Rehabilitation, its affiliate organizations, members, or governing council. Medical statements made in this or other AOCPMR video should not be treated as individual medical advice. Consult your physician and/or other medical care providers before undertaking or discontinuing any course of medical treatment. You may review the American Osteopathic College of Physical Medicine and Rehabilitation's full medical disclaimer on AOCPMR.org.